this lecture. Let's begin with anatomical and physiological changes in respiratory system. Starting from the chest wall, there is increased rigidity of chest wall because of calcification of intercostal cartilage. Arthritic changes are also seen in costovertebral joints. This increase in calcification of rib cage results in decreased compliance of the chest wall. The osteoporotic vertebral collapse results in kyphosis of the thoracic spine. This increases AP diameter of the chest at the expense of the lateral diameter, leading to barrel chest deformity. The strength of respiratory muscles like diaphragm and intercostal muscles decreases with age. The weakening and flattening of diaphragm and loss of mass of the intercostal muscles increases work breathing in older population. Hence, they are prone to respiratory failure. The elasticity of lung tissue decreases due to reorganization of elastin. Moreover, the surfactant production also decreases. This loss of elastic recoil of lung tissue increases lung compliance, causes collapse of small airways, and overdistension of alveoli. Here we can see that decreased radial traction by the elastic recoil of the surrounding tissue and loss of cartilaginous support with age results in